Here we're going to show a glenohumeral joint injection in a 74-year-old male with severe arthritis of the glenohumeral joint, which you can see here in his MRI. Here's the approach. We're using a 3.5-inch needle, and we're basically going in plane, and we're going from a lateral to medial direction. You probably only need a 2.5-inch needle, but in this case I'm using an 18-gauge 3.5-inch needle. And notice that the syringe is not hooked onto the needle, as you want to keep that stylet in the needle, which allows you to cut through the tissue better. So here we are starting the procedure. You can see the needle coming in from the right side of the screen. Right now we're going through the infraspinatus tendon. We just went through the deltoid muscle and the subdeltoid fascia, and now we're essentially trying to get the needle tip right to that bare area on the posterior proximal humerus, which is essentially where there's no tendon attaching. It's between the humeral head and the greater tuberosity. So once we get to that target, we take out our stylet, and now we hook on our medication. In this case, we're using viscosupplementation, and here we are starting the procedure. You can see how that anechoic fluid is essentially piling up underneath the infraspinatus tendon, and it's key again to be underneath that tendon. This way you know you're intra-articular, and you can see the injectate essentially spread over the humeral head and immediately into the joint. Now we're going to repeat this injection just at 50% speed, just so we can go over it again. You see that initial flash, which is some air in the injectate, again contouring the underbelly of the infraspinatus tendon, and now you can see that there's increased anechoic signal under the infraspinatus tendon, which again is the injectate, which is filling up the glenohumeral joint. And this is a really nice approach because you can see the needle, and again, you're not trying to squeeze the needle between the humeral head and the glenoid, and it's again a very safe approach because you're really just heading for that bare area, which is essentially just bone. So if you nick that, you won't be injuring any articular cartilage. Here we're going to look at another injection about a week later in the same shoulder. So here we're starting the injection, again using a 3.5 18-gauge needle. Here I'm heading towards the bare area. I feel like I'm a little bit lateral. Seems like I'm just medial to where the tendon is inserting. So I wasn't sure if I was near the insertion, so I decided to actually abort on this approach and pull back on the needle, which you can see that I'm doing here. Just got to be careful when you pull back because it's inside a tendon, and when you pull back it can kind of jump back at you, the needle, so you don't want to inadvertently pull out the needle, so you just got to be careful pulling back. So here I am, I pulled back, I reorientated the needle heading a little bit more medially, and here's that needle tip going through the infraspinatus tendon, and here you can see the tip is just under the infraspinatus tendon over the bare area at the junction where the bare area meets the humeral head. So this is just where I wanted it. Took out my stylet and putting on viscosupplementation now. And here we're proceeding with the injection. So you can see that flash contouring the underbelly of the infraspinatus tendon. That confirms we're in the correct location. You can see this dark anechoic signal pushing up on the underbelly of the infraspinatus tendon and over the humeral head, confirming that we're in the joint space. And even though the initial stick can be painful, given this is a long, large needle, once you get the needle in the space, the injection itself should not be very painful for the patient. And here is the injection, just the same procedure, just at half speed. So again, here's that needle tip just above the bare area. Here we're proceeding with the injection. You can see that bright flash, which is air in the injectate, contouring the underbelly of the infraspinatus tendon. And now you can see the injectate fill up that space between the humeral head and the infraspinatus tendon, confirming that we're intra-articular. Here we're going to look at a model of this procedure. Again, this is an in-plane approach. You can see the needle in line with the probe. We're basically putting the probe along the long axis of the infraspinatus tendon, and then we go in with this 2.5 to 3.5 inch needle, and we have to go through the infraspinatus tendon through capsule. And here we are proceeding with the injection. You can see the capsule getting distended. We do not have the rotator cuff in this image, and then with the capsule removed, we can see where the needle is essentially at the junction of the hyaline cartilage of the humeral head with the bare area of the proximal humerus.